Okay, so started recording it. All right, ready to go? Let me go ahead and resume sharing the screen. Okay, what we're gonna do is the same thing we always do. You guys should know the drill by now. So, okay, so we have a 40 question midterm review Kahoot. We're gonna do the exact same thing we always do. So go ahead and be prepared to use your ID numbers. And most of the questions are gonna be questions that will either help you with this midterm, or they could even be exact questions for the midterm. And the top 5 people are going to get extra credits, and that's pretty much it. So let's go ahead and get started. Go ahead and sign in, and this is your PIN number up here. So if you ever get logged out by accident, you can always go back in. Okay, so is this pretty much everybody? I'm guessing. All right, we're just gonna go ahead and start. If you need to get back in, of course, this is the website. It's the same website we always use. And the PIN number is usually always down at the bottom, so you can easily go ahead and get back in. All right, secondary prevention. You guys, secondary prevention is assuming, or not really assuming, but this is the next level. This is going beyond primary prevention. So remember, back in primary prevention was when you do things to reduce your chances of even getting a disease. Okay, so that would be what blue is: reduction of the probability that a disease will develop in the future. That's primary prevention. Okay, secondary prevention is like the next level, going beyond that. So let's say you just assume you could possibly have a disease. So secondary prevention would be either early detection of a disease, okay, so doing any kind of diagnostic exam, to detect if you have some early on disease, or it could also be early treatment of a disease. So maybe you just found out that you actually do have a disease or something, and now you're being treated early for it before it really progresses, okay, and really manifests itself completely. Okay, so that would be secondary prevention. Now, tertiary prevention is you already have a very established disease. Okay, you have this disease and there's no going back. You're not trying to really prevent anything, that disease from occurring in the future, or from developing or further progressing, because it's already there. It's fully manifested. But what you are trying to prevent in tertiary prevention is is from anything else developing out of this disease. Okay. Okay. And you don't, of course, you don't want anything to further progress, but many times it's fully manifested, it's really got you good. And, but you still, that will also make you vulnerable to a lot of other diseases because when you do have something, it's going to weaken it's going to compromise your immune system. Also, if you have something and maybe you're in a hospital getting treatment for this, that is also going to compromise you in such a way where you could be at risk for any kind of infection or anything like that. So at that point, that type of a treatment and doing things like that to prevent other things from happening to you would be tertiary prevention. Okay, or even just preventing further decline. Okay, but secondary prevention, this is early detection, early treatment. Okay, does that make sense? Now I kind of talked a lot about this, but I hope you guys get it. All right, let's move on to the next one. Very good job. Good job, everybody. All right. Very good. All right, good job. Wonderful. glad you all got that. Very good. So they're switched, right? It's the other way around. Which conditions are actually the most complex and severe? Subacute's like in the middle. It's not the most complex and severe. What do you guys think, chronic or acute?
Chronic.
Acute. Acute conditions are not cute at all. Okay. They're more episodic, they're short-lived, but the thing is they are the most complex and most severe of all cases, of all, conditions that you can have. Okay. Acute conditions would be something that you would need a specialist for. Like some intense surgery, maybe open heart surgery, that would be an acute thing. Also, if you have gotten into a terrible accident and had to have surgery to kind of put your bones in place or whatever, that would be acute. Subacute would be the next level down from there. So that would be like the level where you're many times when you're in the subacute condition level, you're sort of in that like recovery level. Okay, so you could be coming from a terrible accident where they had to perform all these surgeries on you, put everything back in its place, and then you're moved down to the subacute condition level where you're gonna do some rehab therapy, some recovery, going through recovery time. It might last 2 months, it could last 6 months, but usually subacute conditions you're gonna get over. Okay, it's just going to be a little bit longer in duration than acute conditions. Acute will be like very complex, very severe, but it might be a couple days or a week at the most, or maybe even just a day. Okay, and then you'll be treated, and then you kind of move down into the subacute condition level. So I hope that makes sense. Chronic is going to be like the least complex or least severe, least complex. However, chronic conditions are the longest in duration. Chronic conditions could be lifelong conditions or just very, very long. Okay, usually chronic conditions are those conditions where you can live a normal life, but you're going to have to do something to help maintain your health. Okay, like diabetes, right? Hope that makes sense. Let's move on. Yes, HIV/AIDS, this is now considered a chronic condition because of the new antiretroviral therapies that we have available today. So what's happening now is all you really have to do is just take care of yourself and maintain your condition. And for the most part, you can live a normal life. So it's really just a chronic condition now. secondary prevention, guys, remember, secondary prevention is early detection and early treatment. Primary prevention, this is just this is taking measures to prevent disease from even happening. Okay, so washing your hands would be primary prevention because we're trying to keep ourselves clean and keep germs off of us to prevent infection, right? Prostate exams, those are diagnostic exams to see, if maybe you have a disease. Okay, so prostate exams would fall into secondary prevention. Good job, good job. Yes, turning down patients. Do you guys remember what that actually does? What that helps prevent? That's when
like skin sores.
Yeah, exactly, like bed sores. That's like when maybe you have surgery, you're bed bound, or you're in the hospital or whatever, or you could just be a bed bound patient at home. But the thing is, you need to be moving. You can't lay in one position all day, every day, because you will start to bruise and you're going to get those sores, okay, and they could get infected. Okay, so that would be turning you around, making you switch sides to prevent those sores from happening, to prevent infection. It's part of tertiary prevention. You kind of get that? Okay. Good job. Wonderful. Go whoever this is. Woo! Good job, everybody. Good job. And remember, this was just to house people, right? They didn't provide any treatments for these people. Okay, it was really just food and shelter and get them away from everybody else. All right, good job, guys. It's a whole class. Very good job. All right. Okay, non-physician practitioners are those practitioners who basically do the things that a physician does, but they're not physicians. Okay, that's pretty much the basic definition. So those who count as a non-physician practitioner would be a nurse practitioner, okay, a midwife, um, a certified nurse anesthesiast, a physician's assistant. These are all going to be non-physician practitioners. We do have a couple back in the video that we made on this in chapter 4, I believe. What are osteopaths? Do you guys remember what are osteopaths? Are those non-physician practitioners or are they actual physicians? They're definitely not non-physician practitioners, you guys. They're physicians. They're actual doctors. Okay. Doctors of osteopathy are actual physicians. They are trained in allopathic medicine, same thing as an MD, but they are also trained in alternative medicine as well. So they're the best of both worlds, if you will. So everyone else is definitely a non-physician practitioner on here. Okay. All right. Mm-hmm. Yeah, you guys. So our technological imperative is this American desire really to have the best of the best stuff out there. Okay. It's this drive that we have collectively as Americans that makes us want to go out and innovate, create the best stuff, um, and have that fully diffused in our society and our market so we can use it. And then clearly, and then it's always never good enough, so we have to go back and develop more technology and everything like that. So it's really what drives us and the industry, and it's what gets us to want to keep dumping more money into the system so that we can create more things like this, and then all of that. So the expectations that Americans have about what medical technology can do to cure our illnesses is based on this technological imperative. It's this, like, we want technology so bad, and we believe in science. We believe that technology is going to be like the answers to everything. It's kind of like why we have this new obsession now with AI and things like that. So there's that. because deductibles are paid once a year. And then for those insurance companies that charge deductibles, generally you have to pay your deductible before you can even receive any kind of medical service, before you can use your medical benefits. Okay, this isn't every health insurance that uses deductibles, but for those that do, it is a large amount of money. Okay, it tends to be around 15-ish, 1500-ish. Could be more, could be a little bit less, but usually that's what you have to pay at once a year in order for you to even access your health benefits. So before you can even go see a doctor, really, you have to get that paid. Otherwise, you're paying for your doctor visit on your own. Okay. Okay. Each time the insured receives healthcare services, you guys, that's a copay. I think a lot of us have, or should have, or some of us have insurances that charge copays. That's actually very common. So, and the copay is usually, it might be like $20. It's not so much, but it's usually every time that you go in and to receive any kind of healthcare services, you have to pay a copay. Okay, unless it has something to do with preventative health or something like that. There are some exceptions, but usually for most healthcare services that charge copays, you have to pay your copay before you are able to have any kind of healthcare services. So the deductible, that's once a year. That's a large sum of money that you have to pay before your insurance even kicks in, really. Okay. And just so you know, so we don't get this wrong, a premium is the amount of money you're going to pay every month. Okay, that's like your membership dues for health insurance. Okay, that's what a premium is. Okay. Okay, I'll take it. Okay, very good. job. So under the ACA, there's no special program or anything like that that covers pre-existing conditions. They're just covered. That's it. Private insurance plans, everyone has to cover people who have pre-existing conditions no matter what anymore. You're not in the video lectures, you guys should have seen that there are no limitations allowed anymore. So back in the old days, the old way that they used to do insurance was they would evaluate your level of risk. Okay, so the underwriter would figure out if you are high risk, you're low risk, how much money they think you're gonna, how much of their money they think you're gonna spend on your healthcare. Okay, and if they think that you're high risk, well, they'll insure you, but they're going to charge you really high premiums, high deductibles, and they're going to put limits on your insurance. Okay, they're going to say that there's only so much money that they're willing to spend per year on you. And also they're going to put like a lifetime cap on you. Okay, and when the ACA came in, it made all of that illegal. Okay, so insurance companies cannot determine what level of risk you are anymore. They can't put you in a high risk pool and charge you high premiums anymore. They just have to treat everyone equally. Remember when we looked at the different ways you can be evaluated, your level of risk can be evaluated when we saw pre-existing or the experience rating, we saw community rating, and then adjusted community rating. Adjusted community rating is what is required by the ACA, which means we are not allowed to do experience rating anymore. Okay, so everyone is going to be put into the same pool, and we're all supposed to be paying the same amount for premiums. There are no limits and there's no caps on our insurances anymore. Okay, so there's no special program for people with pre-existing conditions. It's just insurance for everybody. Like everyone's equal in insurance world now. So I hope that makes sense. job. In a single payer system, usually, well, it doesn't really matter which type because a social and national health insurance system, they're both single payers, right? So is it usually going to be financed by an insurance company or is it the government? What do you guys think?
The government.
The government. Yes, I don't think it's ever been done with a private insurance company. So, yes, that's why this is false. Okay. Good job. You guys, do we have more specialists or generalists in this country? What have we been talking about this whole quarter?
There's more specialists.
We have way more specialists. Absolutely right. We have so much more specialists than generalists. That's actually the problem. Okay. So we have a shortage of generalists. We have an overabundance in specialists. Okay. Good job. All right, good job there. Okay, so those are our top 5. Do we have any more questions about what's going on with this midterm? There are 50 questions. First, I'll just let you guys know. 50 question, multiple choice, true, false. There will be a bonus question in the end. For you to answer or not answer is up to you, but it is an essay question. So for max points on that, you definitely need to show support for your answers and answer the questions thoroughly. Okay. Do we have any other questions about this? Okay, so in the next coming week, I will give more information regarding the research project as well. So I'll probably make a video or at least have some sort of PowerPoint or something like that to give you guys so that you have more information about what you need to do. But going forward, I need you guys to start messaging me about who is in your group. Okay, or if you're gonna work alone, or if you need a group. Okay, we need to start getting that settled now. So this week is when you guys need to figure that out. Okay, in addition to taking the midterm. So message me very soon, within the next day or so, about if you already have a group, I need to know who's in your group. If you decide that you want to do everything by yourself, let me know. Okay, and then if you need me to put you in a group, I will do that, but you just have to tell me to put you in a group. Okay, I think there is a message. You're gonna have 2 hours to finish the midterm. Okay, 2 hours to finish the midterm. It's gonna be, other than that, it's the same rules as usual. So anything else? Are we good? Any other questions? Nothing at all?
Thanks for the review.
Okay, so that means no problem. So I guess we're done. Go ahead and email me if you have any further questions, but also I just need to Wait, hang on. So give me a second. I'm gonna go ahead and take attendance real quick. And okay. Yes. All right, so anyway, we're done. You know, if you have any further concerns or anything like that, please let me know. I'm gonna go ahead and let this video process, and then we're just gonna put that on YouTube for you guys to access if you need it for later. And the midterm should already be up for those of you who want to just take it right away. Okay. All right. Bye, everybody.